Good evening. You're on the Whole Healing Radio Show. I'm your host, Dr. Amy Dayries, and tonight's guest is Dr. Michael Lyles. Dr. Lyles is a psychiatrist in the Roswell, Georgia area, but he's done many things, and I'd like to explain a few of the many accomplishments that he has done. Dr. Lyles is a graduate of the University of Michigan's 6-year pre-medical medical program. He completed his psychiatric residency at Duke University Medical Center, where he was the recipient of the North Carolina Psychiatric Association Resident of the Year Award. He was assistant professor of psychiatry and associate director of outpatient services at the University of Kentucky College of Medicine. Dr. Lyles moved to the Atlanta area in 1986 to enter private practice and has served as the medical director of a partial hospitalization program, outpatient chemical dependency program, and inpatient psychiatric units at 3 different facilities. He's worked in private practice in a community medical health center, state psychiatric hospital and county, state and federal prisons. He's committed to raising the standard of care in the community by teaching gatekeepers such as clergy and primary care doctors, along with lay groups. He's a consultant to a variety of community organizations, ranging from religious organizations to internet sites to professional athletics, such as the Atlanta Hawks. That's really cool. He is board certified in adult psychiatry by the American Board of Psychiatry and Neurology. His major areas of clinical activity are mood disorders, anxiety disorders, ADHD. He's published over 60 publications and videos and serves on the speaking and advisory boards for several pharmaceutical companies. And tonight we're going to be talking about what your spit can say about you. Dr. Lyles, thank you so much for coming on. I'm truly honored. I've known you for a number of years. I know you've taught a lot of professional groups about these types of topics.
I'm honored to be here.
Thank you. Really, I'm really thrilled. So how did you get in? You came in, or I had a conversation with you a number of years back about gene SNPs, and you were telling me how you could test somebody's saliva, and it helps you sometimes determine what type of medication program might be recommended for that person. Right. How did you get into this and find out about it?
Because I've been a psychiatrist for 36 years.
Yes.
And one of the problems in medicine is trying to figure out how do you match up a treatment plan with the patient's story, with the problems they're presenting with. And that's been a challenge in psychiatry my whole career. I call it the search for objectivity. How do you objectively come up with a plan that will efficiently address the patient's needs? Over the course of my career, people have tried looking at blood tests, brain scans, cerebral spinal fluid, urine tests, all kinds of things to try to get data that would reliably tell us what was going on with the patient and a treatment plan that we can match up with them that would make a difference. Since probably about 2007, there's been tremendous research on using genetic profiling to try to give us some data that will help us get to what's the right treatment plan for that patient quicker. And the nice thing about genetics is that it's the patient's own genes. The problem for a lot of the testing that was done with scanning and things is that you look at large populations of people and you'll say that a certain percentage of people may have this result on this test and that might mean this. Well, but a large group of people, how they respond to something is very different than if you take one person's customized genes and use that to try to derive information about that patient and how you can go about formulating a treatment plan.
So in your case, when you're treating a patient in the psychiatry realm, this is the type of person that might have a bad reaction to, for example, like an antidepressant. They might have the opposite or undesired reaction. They might become suicidal or something.
Oh, I saw someone today. She was put on, I was psychiatrist number 5. She has been in the hospital 3 times, has been on 6 different medications, had allergic reactions to 2 of them, and non-response to the rest of them.
Wow.
And she's saying, are you guys just throwing something up against the wall to see what sticks?
That's bad.
Okay.
That's not good.
Yeah, and she wanted something a little bit more structured than that. Okay. And that's what we can do with the beginning concepts of genetic testing, is that it's giving us a window of opportunity to try to answer that patient's question because really what you're wanting to do clinically is listen to a patient's story, tell them what might work, tell them what would not work, tell them about why some of the things they took in the past did not work. Can I tell her why she had an allergic reaction to the things she had an allergic reaction to, and can we predict what would work going forward? You do that with a carefully obtained clinical history, and then you use objective data to try to help answer that question.
So you told me that this was something really big in your field a few years ago, and so you inspired me to look into it for the field of dentistry. And so since you've told me about it, it's something I've been able to sometimes perform on my patients doing salivary testing. And in my case, it can sometimes help reduce inflammation in the mouth because people may not be processing vitamins like they're not absorbing it in their diet.
Right.
And if they take a certain form of that vitamin, for instance, folic acid or vitamin B12, it really can help reduce their overall inflammation and periodontal trouble.
Right.
So that's been fascinating.
Oh, the whole genetic thing extends across all of clinical medicine. The field where I think there's the most promise is oncology, because if someone has cancer and you put them on a chemotherapy regimen, I have a cousin that had lung cancer. He didn't die from lung cancer. He died from his chemotherapy. It
happens a lot, I think.
Which eliminated all of his blood counts, and he died from that. Is it possible to take a genetic footprint of a certain kind of cancer and then match a treatment plan that involves a certain type of chemotherapy that's been shown to be safer or more effective for that cancer based on a genetic footprint? That's what a lot of research is trying to do.
That's fabulous.
Yeah, we're trying to get smarter about what we do.
More individualized with the care.
Yeah, more individualized.
And then your
customized medicine.
Customized medicine. And then you're going to get a lot better result because it's really going to be best geared for what the patient's going to process.
You let their genes tell you what they need.
You say it best. You really do. So can you talk about maybe some of the types of testing or how you do it in your office? It's so easy, really, for the patient to undergo this testing.
Well, I'll just talk about the lady I saw today. It made a lot of sense to do genetic testing on her, given her history.
Definitely. You don't want to put her on another bad medicine.
The last thing I want to do is guess. So it was a pattern to the medicines that she had been on. She had been on a lot of medicines that do the same thing. We can do genetic testing, a lot of medicines that work on serotonin. We can look at genetic testing to see if she has the genetic material for the serotonin receptor that these medicines require her to have. If she has a mutation that causes her to have a small number of these receptors, these reuptake pumps, then the medicines aren't going to work because the medicines require her to have these pumps for them to work.
Because they're serotonin reuptake inhibitor drugs.
Right. These are serotonin reuptake inhibitor drugs, the Prozacs and the Zoloft and the Celexas and the Lexapros of the world. They require you to have a certain anatomical pump, a reuptake pump, for them to work. We can look genetically at whether you have a mutation that causes you to have a smaller number of those pumps so that those drugs are going to have a lower statistical risk of working. We can also look at how medicines are metabolized. So if she has that, then that explains why. Remember, we always want to be able to, doctors are know-it-alls. We want to be able to explain everything. Why something didn't work, why something would work, why something might work better, why something might cause a side effect, why something might trigger an allergic reaction. And I don't want to say that genetic testing is at the point where we have all of that, in place. But we're making good progress, and we do have places where we can gain data to help our decision making. With that lady, I'll be able to tell whether she has the right machinery to even take those kinds of medicines. If she does not, she should not. There's about 40 antidepressants to pick from. I can eliminate 2/3 of them right off the bat because she doesn't have the anatomy for those drugs to work.
I think that's pretty mind-blowing.
Yeah. And that's guided based on data, not guessing. The second thing we can look at is how medicines are metabolized by your liver. When you take any kind of medicine for anything, a lot of them are metabolized by your liver. Your liver is the sewer treatment plant of your body.
Yes.
And I always tell people, remember that next time you eat liver and onions and chicken livers, because you're eating the sewer treatment plant of a chicken or a pig or a cow.
You don't eat livers, do you?
Once a year. Once a year.
You don't make them sound very appetizing.
And I pinch my nose. I grew up eating them before I knew better. But we can look at how fast your liver metabolizes different medicines. If you're a fast metabolizer, it means you clear the medicine out of your system quicker. You're going to need a higher dosage of that medicine in order to get to predicted response, assuming it's the right medicine for you. A lot of medicines, if you don't dose them right, they don't work.
Yeah.
Conversely, if you're a slow metabolizer and you eliminate medicines very slow, a particular medicine very slowly from your body, it's going to build up in your system, and you get more side effects.
Yes.
So liver testing, if you will, looking at liver enzyme speeds of your cytochrome P450 enzyme systems will give you guidance as to how you dose a medicine, what's the potential for side effects. And the worst medicine on the face of the earth is the one the patient didn't take because they got side effects. You never made it to finding out if it was going to work because they were too busy having a headache or throwing up, because the medicine's blood level got too high and they never got a chance to find out if it would be helpful for them.
That makes sense.
So this lady, if she comes back being a slow metabolizer, like I think she will be, you'll have to start at very, very low levels for her to tolerate it. Then the third thing, all of these antidepressants for this particular lady with depression work on neurotransmitters, serotonin, norepinephrine, dopamine. And more recently, we have a lot of data about glutamate, the newest antidepressant that people are getting all excited about. Well, I'm from Detroit, okay? So I use too many car analogies, okay? Antidepressants allow you to get more miles per gallon out of one of these neurotransmitters by blocking reuptake so that they are not recycled as quickly. They stay out and do their thing, exert their effect on nerve membranes longer. So it's more miles per gallon out of serotonin, norepinephrine, or dopamine. It assumes you have serotonin, dopamine, or norepinephrine, because none of these drugs put any gas in the tank. Methylene tetrahydrofolate reductase is a test that we do, MTHFR, because nobody wants to say that more than once. It's the so-called mother-father gene. Is a way of looking at how you make neurotransmitters, how you put gas in the tank. If you have a defect in that gene, you don't have that much gas in the tank. So if you only have 1 gallon of gas in your tank, and you're taking a medicine that gives you 40 miles a gallon, you're not going to Chattanooga from Atlanta, because that's 72 miles away.
That's a really good analogy.
Even if you get to 40 or 50 miles a gallon, you're not going to Chattanooga. You will not get your desired end game because you don't have the gas.
And that's about half the population, roughly, is going to have MTHFR.
We'll have varying degrees of it. And not knowing that sets you up for failure right off the bat if the patient doesn't have the raw material that the patient needs to respond to a treatment.
Wow.
And MTHFR is involved in a lot of things. It's involved in cardiovascular health. It's involved in reproductive health. Not just psychiatry. It's a number of other areas, autism, that people are wondering about whether this is involved.
Yes. We wonder about it with gum disease. And now we're back with Dr. Lyles to talk about gene SNPs, and we were talking about the mother-father gene. MTHFR is one of the abbreviations. And you brought up a good point on our break, and I'll let you talk. Sorry.
Been talking about gene SNPs and mutations and talking about it with patients. A lot of times, first of all, it's a whole realm of activity in terms of direct-to-consumer genetic testing that patients get themselves independent of their doctor. And they may find out that they have a whole list of potential gene mutations that might result in them having Alzheimer's one day, or maybe having a greater risk for cardiovascular disease, and so forth. And sometimes people get very upset and assume that their life is now ruined, that they now know what the trajectory of their life will be, and it's because they have these bad genes and they're doomed.
Right.
And one of the things that I wanted to say early on about talking about genes is that just because you have a gene for something does not mean that gene is expressed or turned on. Okay? I always use the example with my patients. Because most of my patients are middle-aged, and I said, do you know someone that had breast cancer? Yes. Do you know if that person had the BRCA gene? for breast cancer. Oh yeah, I know somebody, their sister had the BRCA gene and they had a mastectomy because they found out they had the BRCA gene and they didn't want to get breast cancer. Well, when did that person's sister get born? Did they have the BRCA gene from birth? Well, of course, because it's a gene they were born with. When did they get breast cancer? 52. So why, if a gene is going to kill you or cause you to have this disease, what caused it to only become active at 52 and not at 42 or 32 or 22? And that brings in the whole idea of epigenetics. Epigenetics is the study of things that turn genes on and off. And it's a very complicated area. That's where a lot of research is going on.
That's right.
Looking at things that affect histones that cause genes to open up and become expressed. Transcription factor, which for those of us with some gray hair, the way genes are read, if you have a gene, it's like a vinyl record, and it's a needle that sits on the record and reads that gene. It's called transcription factor. It reads the messages in the genes. And certain things may be involved in causing transcription factor to read and express bad genes, or maybe skip over them or not read them. A tremendous amount of research is looking at all of this stuff.
So one of the things I've noticed, or I often will mention to patients, is if you had identical twins, they might look quite identical for a number of years. But then oftentimes when they start to hit middle age and as they get older, they start looking a little bit less alike. You can now really tell Bill from Ted because they don't look the same anymore.
Right.
And that's what we now believe to be the turning on of these gene SNPs, the epigenetics.
Yes. And the thing that's so nice about epigenetics is that it gets rid of the doomsday deal, because epigenetics are things like diet and exercise. Choices that you can make in your lifestyle. One of the things that in psychiatry we've been studying lately is air pollution. Does air pollution, to what degree does it act as an epigenetic factor in causing gene expression?
Sure.
But I tell the patient I saw a patient today that had gone to Vanderbilt and found out that she had a gene that might put her at risk for Alzheimer's when she's in her mid-60s and she's 40. And she was very depressed about it. And I said, what that means then is that right now, we got to look at your diet. We got to look at how well you sleep. We got to look at your exercise.
Right.
We need to look at the things you can control. Let's talk about the things you get a vote on, because epigenetics, many of those things are things you get a vote on.
Yes.
And one of the things you do not want to do is get depressed, because depression is a negative epigenetic variable for a lot of these diseases, heart disease, diabetes, maybe certain forms of dementia. So it's all about helping patients to use genetic information to guide their choices, the things they get a vote. You don't get a vote on what you're born with genetically. You do get a vote on what you do with it.
Yes. I love that way of thinking and the way of saying it. So a few years ago, I found out that I tested positive for some of these gene SNPs that are commonly tested for now. But for what it did for me is it enabled me to realize how important for me it is to take, in some cases, a vitamin supplement, at least on a pretty regular basis.
Yes. Oh, the supplement thing is very important. In fact, I saw a patient with ADHD, and he can't take stimulants because he has heart disease. He can't take some of the non-stimulants because they don't work. He's tried them. And he said, what do I do now? I said, I tell you what, we got to control the things we can control. We know that there are certain supplements that will help your cognitive functioning. And it's probably helping cognitive functioning by helping epigenetics.
Yes.
Because ADHD is a highly genetic disease state. So we have him taking B vitamins. We have him taking vitamin D. We have him taking high EPA fish oil.
Great.
We told him about he has to get more sleep.
Yes.
He needs to get involved in aerobic exercise. And in particular, some literature that suggests, I went to Harvard to a continuing medical education meeting. I heard somebody giving a lecture about supplements and things for ADHD and exercise. And he said the best, you will never guess, the best exercise for ADHD that a Harvard Bostonian recommended: line dancing.
Line dancing? That's
Line
not
dancing.
what I would have guessed.
You would have never in a million years guessed line
Right,
dancing.
that's awesome.
Because it involved an aerobic activity in a group of people that required you to coordinate your activity with those people, and it gives your brain a better workout.
Super cool.
As opposed to just riding on a stationary bike by yourself.
Sure. It's social.
It's social.
A lot of things you're having to do at the same time. Very cool.
So spin classes and that kind of thing.
Yes.
You're exercising with other people. It makes a difference in the quality of outcome you get from the exercise.
That's great. That's great.
Yeah. So I try to focus my patients on looking at what can we change. You know, you can't change, how you grew up. You can't change, your genes that you were born with. You can change what you do with that, how you react to it, how you order your life going forward.
All right. Well, let's talk about maybe some of the gene SNPs that you commonly run into or end up talking about with your patients. There's certain ones that are going to be linked to mood disorders, or there's more of a commonality that happens more often when people come and see you. It just so happens they often have certain of these gene SNPs.
Yeah, in psychiatry, there's been a lot of controversy about gene SNPs because there's some that everybody agree. In fact, the FDA issued guidance the end of last year about the whole genetic testing thing, particularly with pharmacogenetics. The ones with the best evidence that everybody agrees on are the genes that are involved in liver metabolism, how well you metabolize medications.
That's the CYP450.
The CYP, the cytochrome P450 enzyme systems. You got 2D6, you got 1A2. There's different subsets.
Yes.
And I tell people, I don't know how many people are familiar with Atlanta, but enzyme systems are like highway systems in Atlanta. You got I-85, you got I-75, you got 285, you got I-20. And if there's an accident, i.e. somebody's a slow metabolizer on I-75, it may not affect a medicine that's on I-85.
Yes.
But some of these medicines involve areas where if you put a mutation in a system, it will affect everybody. That's like the downtown connector in Atlanta,
yes,
where a lot of these systems run together and cross over. But the good news is that for most medications, they have usually, if there are 4 pathways, they may use 3 of them. And if they have a mutation or a gene SNP in one of them, you got 2 other ways to metabolize it. It's when you have a medicine like there's an ADD medicine, Strattera, that is predominantly metabolized by 2D6. And if that person has a mutation in that system, it's going to affect their dosing of Strattera. Guaranteed. And if you don't know that on the front end, you're going to set that patient up for a lot of trouble. So what clinicians are advised to do is to look in the package insert for all these medicines to see the ones as it relates to liver metabolism that are metabolized predominantly by one system. And if that system has a defect in it, like citalopram with one of the systems, if you have a mutation in one of the systems of that, you have to adjust the dosage down because it goes sky high in the bloodstream. So the whole liver thing, everybody agrees on. The serotonin receptor gene, which is the SLC6A4 is the name for it.
Yes.
I love these names for these genes. But it's the gene that codes for the serotonin reuptake pump, which is the recycling pump that allows you to utilize serotonin over and over and over again. The literature that's out there would indicate that if you have a defect in that pump in the context of early childhood trauma,
yes,
that you're more at risk for having depression going forward. And again, I told you earlier that if you have that particular problem, there are certain medications that aren't going to work because they require you to have an intact pump for them to work properly.
yes.
And there's a number of others that there's a lot of debate about the ones for ADHD,
Okay.
a lot of debate about the ones for other neurotransmitters because the serotonin pump is a serotonin one. What we need is to get more data about dopamine pumps
Okay.
and norepinephrine pumps. The COMT gene is more of a norepinephrine pump that people have debated about how reliable and accurate it is across the board. But for individual patients, it gives us some data, some guidance about what to do in predicting a treatment plan. So there's a lot of research going on trying to correlate the significance of these genes with the disease states. The problem I run into, that my secretary was fussing about this morning, is that I'll have a patient that will call my office, and the patient will want a 15-minute appointment just to come get a saliva test done so that I could tell them what medicine they need to be on without even seeing the patient.
And so now we're back on the Whole Healing Show. So we were talking about how you had a patient call, and they wanted the 15-minute appointment. They probably just want to pay for a gene snip study and an interpretation of it. And why doesn't that work? Why can't we just do that for people? There's a lot of reasons, but...
First of all, I wouldn't even know what to order.
Right.
How do I know what to order when I don't know what's going on with the patient?
You wouldn't know her medical history at all, would you, or what she's been through?
No. One of the problems of emerging technologies like this is that it sets up an unrealistic expectation of benefit. There are patients who believe that all we need to do is a saliva test without examining the patient, without knowing anything about their history, and that we would be able to predict what the treatment plan, what an appropriate treatment plan would be for that patient based on that. And where it's really a problem is direct-to-consumer genetic testing, because really a patient could, technically speaking, get their genes done without seeing me. They don't even need the 15 minutes, to be honest with you, if all they want are the results, because there are a number of direct-to-consumer products out there that will give them a whole list of gene snips.
Yes.
Now, what those gene snips mean and how they fit in the context of the patient's story, they will not have. They will not know if it's a significant thing or not, because just because you have a gene snip doesn't mean it's doing anything.
Right. We don't know if it's activated or not.
It's activated or not. Is it expressed?
Right.
And the patient won't know that. And the way you know that is by listening to the patient's story and asking the right questions and being able to see, is this someone where a gene snip is actually having an influence on that patient's life currently. But the patient who thinks that we can just do that and that you're going to get a computer printout that says everything they need to do, that's not going to happen anytime soon.
Right.
That's stuff
in movies. Possible. That is stuff in movies.
That's in movies.
Well, and the other thing is a lot of times people find out that they have something and I think they sort of freak out or they get very concerned because they Google it and they find out all the potential ramifications if it's fully expressed.
Right.
And it can cut them up kind of on a ledge at the top of a tree and they don't know, they may not need to be up there.
I have a patient who's a minister. He's pastor of a church. Dealt with depression most of his ever since he was in college, and he's in his 50s now. Horrible depression, didn't respond to anything, been in therapy, several medications, came to me. I said, let's do your genetics. I listened to his story, saw the pattern of what was going on, because, if I just do a saliva test, I don't know if the person's got depression, if they have thyroid problems, if it's a medication side effect. It could be a lot of things. He really did have a legitimate depression. And people had tried to treat him properly. And we did his genetics, and it was horrible. It was one of the worst ones I've ever seen.
He had everything.
He had,
I guess.
both gene snips, both mutations for your MTHFR.
Oh, wow.
He didn't hardly have any. He had a mutation for his serotonin reuptake pump. He metabolized medicines horribly. He had early childhood trauma. According to the books, the man should have had about 4 or 5 psychiatric hospitalizations. He should have been suicidal repeatedly because of a lack of serotonin activity. And this man had pastored a church.
Wow.
Successfully.
So he's taking on all of those people's
he's been taking on the pain of people when his depression should have been much worse than what his genes said. His genes said his depression should have been much worse than what it actually was. He should be isolated on disability, sitting at home thinking about suicide chronically. And this man had a graduate degree, a master's degree, and was in a position of serving other people.
Wow.
And when I went over his genetics, which gave us some guidance about which medicine to put him on to make it so he could feel better, I said, even with a poor response to medicine, you have outperformed your genes. How did that happen? And he began to tell me about the support that he got from family and friends over the years.
Wow.
And how his faith made a difference for him. And he said, it's more to, he tells me,
Yes.
Dr. Lyles, is more to it than genes. It's how you respond to these genes.
He had some resilience.
Yeah, then he started to, preach at me about what he didn't realize he was preaching about was epigenetics.
How about that?
About the importance of relationships and how relationships have made a big difference in him being insulated against what could have happened with his genetic profile. He was now, instead of feeling doomed, he felt very grateful for the people that had been there for him when he was going through difficult times, because he says that's the reason why it wasn't much worse.
Wow.
And I believe him.
Attitude can make such a difference.
Attitude. With all diseases.
Yes.
Arthritis, cancer. I went through treatment for prostate cancer and spent way too much time in cancer centers with other cancer patients. And we developed our own support group. With prostate cancer, you have to drink a certain amount of fluid before you have your radiation treatment. So we called ourselves the Drinking Boys. And we get together
That's so
early,
beautiful, really.
and kind of support each other before everybody had their radiation treatment.
Wow.
And all of us have had a good outcome.
That is amazing.
Because we're keeping up with each other. In fact, had dinner together a few weeks ago.
That is great.
And the pitiful part, those people at the radiation center said that that's never happened before.
Oh,
and that should happen all the time.
What if that happens all the time?
What if that happened all the time? How would that affect outcome for disease states if people supported each other more? That is, technically speaking, an epigenetic variable.
Yes. That's a far undervalued variable in today's society, I would say. That's amazing. Wish you published a study on that, or maybe you have.
I haven't published a study on that, on my drinking buddies.
Right. Well, they'd probably think it's pretty cool, too, to realize how amazing that is.
Oh, all of us know that the reason we've all had good outcomes is because we've been there for each other. We've been there for each other. In fact, we would get there a half hour, 45 minutes early just so that we could hang around and talk to each other.
That means a lot, especially, I think, for men. I don't think there's as many outlets that just sort of naturally happen for men who are in the workplace. Oh, no. In fact, one of the horrific things that I found out with my prostate cancer experience is how many friends and golf buddies I had that had already been through prostate cancer and didn't tell anybody and suffered with it in isolation. And now that they found out I had it, they come up and they go, Mike, I had it too. And they whisper it when nobody's around. And that's the exact opposite. It doesn't have to be a secret. Right. That's the exact opposite of how you deal with any disease state, be it cancer, arthritis, heart disease, anything. In psychiatry, we make a big deal of it with depressed folks that, we need more than medicine. We need each other. And in terms of gene SNPs, it's because that's a very powerful epigenetic variable. Has your experience with prostate cancer changed how you practice? I mean, in terms of compassion or what you tell patients that they ought to be doing when they leave your office? Oh, golly. I've said for years that what I do for a living is more like an oncologist than anything else in terms of treating people with mood disorders. Because most of my patients are bipolar, of manic depressive illness, which is another highly genetic disease that we're trying to understand. But anytime you've been through major illness yourself, it gives you, when a patient tells me they didn't take their medicine, instead of getting all judgmental and jumping their case, I try to find out why and understand why, because I know I didn't want to show up for my radiation treatments a lot of the time. But I bet those guys would have helped you hold yourself accountable. They would have held you accountable. If I didn't show up. Yes, my phone would have blown up. Good. If any of us. In fact, one guy didn't show up one time because he had gotten sick and he didn't tell us. We wanted to know where he was. Sure. That kind of accountability. In recovery literature, they make a big deal out of it. That's what AA is. AA helps alcoholics get sober because of the dynamic that we're talking about. A sense of accountability to each other that supports people through a difficult time. Wow. I'm thinking to myself how I can start something like that, some sort of a support group with some of our treatment regimens in dentistry, really. Yeah.
And breast cancer, all the Susie Coleman walks, all kinds of things to support women going through breast cancer. Men are horrible when it comes to that kind of thing, and I'm one of them. Men are horrible because they don't talk about the things that are going on like that, because if you're a real man, you just deal with it and shut up.
Right.
And that is not how you deal with something, with any kind of disease state, regardless of the level of genetic influence.
Yes. Yes. Wow. Well, we were talking about gene snaps, but that was, I'm really glad we got into that.
But just because a lot of the diseases that we deal with have genetic impact, but how you respond to it, how you treat it, involves more, like you were talking about earlier with nutrition, it involves more than just taking a pill.
Yes.
It involves a comprehensive picture of doing things that change your lifestyle, that affect relationships are highly powerful, as that minister pointed out. Epigenetic variable that determines whether these genes are going to bite you or not.
Yes. Well, even in that Mediterranean diet, that study, there are studies that have been done on Mediterranean diet if you're trying to reduce inflammation.
Yes.
To maybe reduce the effects of mother-father gene, for example. They show on the bottom of that pyramid people eating together. That's like, and exercising, that's really part of it. It's this lifestyle, this being part of a community.
Being part of a community. Being part of a community. Yes, absolutely. In 36 years of practice, the people who've done the best are the people who are part of a community. That community might be their family of origin. It might be the family that they have created for themselves, their friends. But they're not doing it by themselves. By far, the one thing that the cancer experience taught me is that you don't do these things by yourself. As I was finishing, there was a new guy starting, and he had what the guys call it the big eyes, because he was scared to death. He had the big eyes.
Yes.
What are you going to do to me?
Yes.
And I took him aside and I said, look, don't do this by yourself. We're going to be there for you. I'm finishing, but I pointed to one of the guys that had just started. I said, you got this guy. He's yours now. you got to hold his hand and help him with it to go through it. And that's epigenetics.
That is epigenetics.
Yeah, if you want to be technical about it.
Yeah, that's great.
Yeah.
Oh, I'm so pleased to hear about that.
Yeah.
That story. Dr. Lyles, we've been talking about gene SNPs, and Dr. Lyles does salivary testing, but you could also do blood testing to find out if you are carriers of these so-called gene SNPs. And then you do a lot of discussing with your patients on how you can upregulate or downplay you don't want to upregulate these. How do you minimize the effect of these gene SNPs in your life?
Right.
Because they affect everything.
They affect everything. One very basic thing that they did not teach me in medical school. When I was in medical school, they said, years from now, it's going to be something we didn't teach you that you're going to realize was important, and it'll be way after you've left medical school, and that's the importance of sleep. Because we were talking about neurotransmitters, you were talking about the MTHFR, the mother-father gene, how it's involved in the synthesis and the making of these neurotransmitters. That occurs in deep sleep.
Yes.
So if people aren't sleeping, it's like not going to the gas station to put gas in the tank. You never go to the gas station, you wonder why you run out. If you have a brand new Prius and you put 1 gallon of gas in it, you're only going to go so far.
Yes.
And if you never go back to the station, i.e. get good sleep, you're going to get in trouble.
Yes.
So that's an example of, the epigenetics. Sleep. You ought to hold up your book.
I wrote a book on solving your sleep problems, solving your sleep for better health. It will be in print by January. It's on Amazon Kindle. Thank you, Dr. Lyles. Solve your sleep for better health. Get to the core of your snore. Get to the core of your snore was actually courtesy of Jesse over here, who's helping produce the show. And we talk about gene SNPs in the book, but we also talk about different vitamins you can take to enhance your sleep, lifestyle choices, herbal supplements that can sometimes help regulate or bring back into balance if your adrenal glands are out of whack, how hormones affect your sleep. What else? We talk about dental appliances, because I make a lot of those to help people with sleep. But the neurotransmitters that you're talking about, cycling it back around to psychiatry and really psychology, really everything. All of these chemicals, when they're out of balance, you're not going to store your fats the same way. You're going to drive up your inflammatory levels, markers like homocysteine levels. But then you'll also have releasings of things like C-reactive proteins, interleukins 1 and 6. These adverse childhood experiences that I bet you deal with a lot too, those really drive up your risk for inflammation.
Yes.
And there is a whole thing called Syndrome Z. Some people out there may have heard of metabolic syndrome or Syndrome X, which involves a lot of times obesity or sedentary lifestyle with when your cholesterol is out of whack or your blood pressure is too high and you start going down a road of cardiovascular disease and diabetes. But when it's also coupled with bad sleep, they call it Syndrome Z. And there's certain gene SNPs that are directly affected by sleep. And there's one called the clock SNP. And it has a whole bunch of letters and numbers with it, like one you mentioned earlier. But it regulates your circadian rhythm. So if you have a marker for that and you have higher inflammation levels, you have gum disease, you have a history of getting a lot of colds, you're running tired, you're not getting enough sleep, you're going to also enhance that problem because you've got this gene SNP that gets upregulated and your circadian rhythm is going to be out of whack. You can't get on a good schedule. So
the one thing that I emphasize with all my patients, in fact, I have patients, most of my patients have bipolar disorder or manic depressive illness. If they don't sleep, we're not going to be successful. Forget about it. The literature would indicate that 89% of relapse in bipolar disorder is related to not sleeping.
wow.
Depression. If you don't correct anxiety and sleep disturbance while treating somebody for depression, they have a tremendous risk for relapse. People with ADHD.
Yes, I was going to mention
if
that.
they don't sleep, they can take Ritalin and Adderall till it's coming out of their ears. They're not going to have maximum cognitive performance.
And sometimes in those kids, it could be that their airway is small and when they were born, they might have had, for instance, a birth trauma that didn't get unwound or completely addressed. They may have had a concussion because they fell out of their high chair.
Right.
And sometimes there's dental appliances that can help develop the palate, which can actually expand the skull, which takes pressure and enlarges the airway. It takes pressure off of some of the nerves and enlarges the airway. And that's what I've really received a lot of joy from caring for some of those patients, because we find that they start making honor roll and things that were really unexpected. Like, who would think you would get a dental appliance to make honor roll? And we don't say, we want you to have this dental appliance so you can make honor roll, but those are some of the side effects when you start unwinding these problems.
Yeah. You know what you treated them with? Air.
Air. Oxygen. Right. We're just full of air in our practice.
Yeah. But air's kind of important.
It sure is.
Yeah, but that's why I think it's important that people really take a look at dissecting these clinical problems down to bite-sized pieces so that you can make the next right decision. And the next right decision isn't just looking at a gene report and going, oh my goodness, my life is over.
Right.
The next right decision is trying to make sure you're doing everything you can with your diet and your exercise and with aggressive medical treatment and dental treatment to do everything you can to give yourself a better outcome. The best advocate for your health is you.
Yes, you're going to know yourself the best.
Yes.
And it's okay to maybe call and ask for gene SNP testing, but you also have to be prepared to understand that the practitioner is going to have an approach, and you've been doing this a number of years, and you've seen a lot of patients, so you're going to be able to approach their special needs with probably a lot of perspective.
Yeah. I tell people I feel like a football coach because they're the player. They're the ones that has to execute the treatment plan and all parts of it, not just taking your medicine, but all the other kinds of things we've been talking about with diet and exercise and sleep and relations and so forth. All of it's important, regardless of your genes, in order to get better. But you have to be committed to exercising that plan, to executing that plan.
Executing the plan. You've got to have some accountability.
Yes.
So find ways to hold yourself accountable, like maybe getting involved in your community, like you said, the exercise class where your buddy's going to say, where are you?
Accountability.
Yeah.
Yeah.
Checking in. We ask people to keep a logbook, maybe for how often they're wearing an appliance, for example. And it's a benchmark. It's not to lecture people when they come in. It's to help them remember where the priorities need to be so that they get success.
Yes. Yes. Give people something to do that they can be accountable for, that's operational, that's not vague, but something that's measurable.
Right. And in terms of if you were to recommend supplements for people, what a lot of times they'll see after just a few weeks of those supplements is a lot of times they'll have increased energy, they may sleep better, they just feel better because they're starting to get the nutrition they couldn't get because of some of their pre-existing problems.
Exactly. I went on a mission trip years ago to West Africa, where they don't have a lot of psychiatric medications.
Yes.
And what they use is exercise and nutrition to help people with depression that are mild to moderately depressed because they don't have access to the technology that we have. But they have PhDs in knowing what to eat and how to exercise.
Wow.
Yeah.
That's fascinating. What an interesting perspective, and to just have seen that.
Yeah.
Wow. And they're doing pretty well overall?
Yeah, my thing was to try to help them get access to more technology, better drugs instead of, this was 5 years ago, and they were just getting Prozac that came out in 1987 in our country, and one of the 4 psychiatrists in the country I was in was telling me about, they were all excited about getting Prozac. So what we have available in the West in terms of treatment options is so much more extensive than in other parts of the world that's why when people don't take advantage of this, they are robbing themselves. They're robbing themselves.
It's really important. It doesn't cost that much to get tested and get it properly worked into a personalized treatment plan.
Right.
It really can change your life.
And most of the testing companies will have links that you can go to, like GeneSight and Genomine, and many of the companies will have links to show you how to find people who do genetic testing in your locality.
Yes.
You enter your zip code, and they'll say these are the people who ordered testing and know how to read it, know how to interpret it, because that's what's really important is what you do with the results.
And there's a lot of courses out there for practitioners who read these, and you really need to take a number of courses. It's a lot of it's a whole other world.
Yeah. I get mad at some of my colleagues that refuse to do it. They say that they don't have to do that. They don't need to do that they can intuitively figure out what to do.
Sure.
And I thought to myself, you were talking about my thing with cancer?
Yes.
When I had cancer, I wanted to know, what studies do you have? What objective data do you have about this choice versus this choice versus this choice that would give me guidance as to what my best outcome would be? I'm not going to let an oncologist go, I just think that we should do this because I think we should do this.
We did this with the last 10 people.
Yeah.
Yeah. We just have a couple of minutes left. Is there anything else you would like to underscore? How can people find you if they would like to come see you as a client?
Yeah, because I've had cancer recently, I'm kind of on a restricted schedule, but I'm in Roswell, Georgia. But if they're really looking for somebody, the way the testing is very easy. It's just a mouth swab. I just tell people, make sure you don't wear lipstick, because the people at the testing company say they know the swab is from the South because it has lipstick.
That's too funny.
But it's very cost effective now. Takes a very short amount of time to do it, about a 1 week turnaround time to get the results. And sit down with somebody who's knowledgeable and see if this will give you guidance about how your treatment plan can be more efficient.
More efficient. Great way to put it. Do you want to give out the phone number for your office, or where they can find you on the internet? Or
it's lylesandcrawford.com.
lylesandcrawford.com.
Yeah.
L-Y-L-E-S
and Crawford.com.
Crawford.com.
Yeah.
Dr. Lyles, I appreciate you coming on. We have just a few more seconds. So we want everyone to get tested for gene SNPs. You don't have to be sick, but I think you'll find ways to make your whole healthcare regimen more effective.
Yeah. Well, a lot of times, like I said, people can get the testing direct to consumer, the 23andMe's of the world, but they do need to sit down with somebody that knows what to do with it.
So then call and schedule an appointment with somebody who can interpret it.
Yes, to interpret it.
Some of the testing services will do a consultation on the phone.
Yes, and some of them will do it on the phone, but don't just do this on your own.
No, you need a little help. It's complicated. It's complicated for doctors when they're first getting into it.
Yes, it is.
So that's what we recommend. But thank you so much again for coming on our program tonight.
Oh, my pleasure.
I really enjoyed it, learned a lot, as I always do when I get to talk with you.
Thank you.
Thank you.